markers and table pins. Looks like everybody's figured that out. Names and certificates.
No, you're good. Good.
Okay, so your minutes should be in your packet that you would have received in an email. I would look to accept the motion to approve the minutes. Anybody second? Any discussion? Any opposed?
I was just gonna make a quick mention. When we've done lunches before, I'll tell you on the owl, it picks up every paper crunch. I don't know what to do about it, but I'm just gonna share that with you. I really want you to enjoy your wonderful lunch. But just sharing.
Owls in the middle. We'll be back now.
We all
Please
open
do so right now.
Yeah.
We'll give you 30 seconds.
Everybody open it now, it's open your bed, have a party, close your ears online, close your ears. Yes, all your paper wrapping.
I agree. I'm always. Okay, Denise does have some handouts she's going to assist with. These are all the documents that the collaborative have kind of worked on in regards to collective impact and results-based accountability. We just thought it would be good to kind of just refresh everybody's memory, take a look at that. It does have our nice little flower petal. Everybody seems to be familiar with, I believe. We had lots of discussion at our agenda development meeting a few weeks ago about at some point maybe laminating some documents so that everybody kind of has them handy for meetings versus like going over them in detail. If anyone is not familiar with this, you can reach out to the collaborative. They do have like an orientation with the engagement team that Michelle usually will take care of getting you set up with. So if you want further explanation in regards to that, Michelle can take care of you. Did we want to, sorry, I know this was Alex's part. Did we want to discuss it maybe a little further or how much she planned in?
Yeah, no, I think that was what her suggestion was. I think you covered this, yeah. There'll be questions. You know, what is collective impact? What is the structure? What are we trying to accomplish? And if this is your first meeting, there'll be a lot of questions because this whole packet of work is what we've completed in the last year. So it's a really good piece to be aware of. If you want to take it with you, we also talked about just keeping a library of them and we'll bring them to every meeting. All of this information is on the website. And Michelle, who's on Zoom, she's in New York right now, headed to Oslo, Germany. So if she's awake next month, she'll join us. But she put that together. She's trying to get a lot of stuff done before she heads over to compete on the national Olympic team. So we'll be hosting parties for Michelle too. So if anyone wants to support the Olympic team, but yeah, she wanted to get that all out to you guys so you have it. All of that information is on the website as well.
The next item that we wanted to talk about is really kind of picking up where we stopped last month. But if everybody could kind of take a look at this document, it was attached to your agenda. And we just kind of wanted to review and see if anybody had any discussion about this document that we put together. And we had lots of discussion about age groups that we wanted to focus on, and really, I think everybody kind of came to the conclusion that we want to focus on them points in time where the child has the most profound brain development going on, which was that prenatal to 3, and then again in pre-adolescence. Do you have anything else they want to offer? The first box, this is really just kind of set up in our RBA format, how much our community is doing. We came up with lots of things that we're doing. I'm sure we have lots more than just that though. Denise was just kind of putting things in spots as we were having that discussion. The next box is how well we do it. And then also, is anyone better off? And we had lots of discussion about, do we have data that would tell us that? I think that might be a huge piece that we're missing right now. So we're trying to kind of pull that together. I think we talked with the steering committee about it, and Dean may be helping us out a little bit as well, to kind of gather some of that information.
The overall intent at the last meeting was to look at everything that we're doing around the community for children, youth, and adolescents, from prenatal to aging out of the system. And really take a hard look at who's our customer when we're doing this work. Is it youth or is it parents? And then we said parents. And then we had a long conversation with some of the age groups. So that results-based accountability, or the RBA piece. Now we want to look at how all of this work starts to align and how we start to measure that we're truly reducing the number of youth entering the system, and then what that means when what we're trying to prevent, what system they're entering into, which some of the work that we're hearing in steering committee is reducing abuse and neglect, reducing truancy, reducing criminal acts, or going into juvenile justice. Thank you, that's your space. We also talked a little bit about mobile crisis. That would be another system you want to reduce entry into, as well as maybe deaths that we could, maybe preventable deaths. That's what I want to say, preventable deaths for you. So that's a little bit of what we were talking about. Yeah.
Next is information or resource sharing.
Yeah, I'm gonna take a stab at this.
Okay.
I am. So as your leadership team, one of the things they said, there's so many wonderful faces around the table. We're just kind of starting to see people's faces that are not one-dimensional. And actually today I had to introduce someone that I've been talking to on Zoom, and I didn't know who she was, and I should have known who she was because I talk with her all the time on Zoom. So it's just like that one dimension going 3-dimension has been hard for me. But the leadership team thought, let's just take some time to really get to know each other. We didn't put much time on the agenda because we want this to be pretty efficient use of our time. So we thought, let's go around, introduce yourself if you would like, and then if you have a resource you want to share with the community. I don't know how many of us are here, but I'm going to just guesstimate you have about 30 to 40 seconds. So brief. I'm going to keep the clock. So that's what I'm saying. I'm going to test this. So if anybody goes over your 40 seconds, I'll probably go, and we'll move to the next person. I also encourage you to bring brochures that you may have of the programs and things that you're doing, and hand those out. And we can make sure that that information gets out to others. So do you want to give it a try? Let's do it. Do it. All right. Oh, you're up. And you can pass if you want to.
Hi, my name is Carmen Throckmorton. I'm with ESU 9. I'm a service provider for elementary and special ed.
All right, my name is Dan Endorf. I'm the Director of Student Services and Safety with KPS. And since Carmen only used about 12 seconds, I'm going to steal her 38 seconds or 28 seconds. So that would be a little bit over a minute. I have a number of handouts, not nearly enough. But our district's contemplating starting something called a student assistance program, which would be 24/7, 365, where you can text or call as a middle school or high school student, someone out there that's an LMHP that's there to help, that can provide crisis counseling immediately, but also just for the student that's depressed, the student that's just a little down in the dumps or stressed out, maybe there's problems at home. I bring this up specifically because after being here a grand total of 4 months, I feel like KPS really does a great job with kids this time of day. So at 12:45 PM, as I look at the clock, I don't know if there's a district doing it better. The problem is at 12:45 AM is sometimes when these students need help the most. And so that's why we're looking at this program, and nothing's a done deal yet, but would like all of you good people to be aware that that's something that we're investing.
Thank you.
Well, my name is George Sekla. I am with the Buffalo County Community Partners, and I am the community response assistant.
And I'm Wanda Fedorchik with Buffalo County Community Partners, and I am one of the central navigators with our community response team. And for those of you that don't know, we have some flex funds available to help families. We work through you guys though, so if you have a family that has a need and there's not another resource in the community, you can contact myself or Martha or anyone on our team, and we can help start that process if there's a need for some funding.
I'm Chance Bell. I am a professor at UNK in the Counseling, School Psychology, and Family Science Department, specifically in the Family Science program, and I'm also a mental health provider in managed care defense service.
My name is Veronica Levine. I'm a prevention coordinator with the Safe Center. We provide, intervention services for those affected by who have experienced violence. We also offer counseling services. Hope and I work as a prevention team, so we have a youth prevention resource called Verify. We're active on social media, trying to engage with youth, talking about healthy relationships. A lot of the things that we're talking about in this collective, we're trying to engage youth with. We do presentations on campus about vice intervention and in some schools when we're able to. And we're also getting ready to launch a community program called Safe Bars, where we partner with local bars or hospitality restaurants and train staff members on vice intervention to prevent sexual assault. So, building upon the skills that they already have, so they can intervene if they see anything happening amongst patrons or amongst staff themselves. So, that's what's going on now.
I'm Hope, and I'm the communications coordinator at the Safe Center.
I'm Matt Bellmeyer, Director of Mission Integration for Good Samaritan Hospital.
I'm around, we either have coordinators with community partners. And I'm Martha Marfileño, I'm the central navigator for the community response program. I'm Jody Trejo. I am a therapist and owner of Midwest Encouragement Counseling Center. We provide child and family services in the community, and then we also contract and provide the early Head Start consultation for our Head Start programs. We provide consultation for families here, and then just do a lot of presenting and trauma-informed care within the community and within the state of Nebraska.
I'm Libby Harsh, Kearney Public Schools. I'm a child care partnership coach for 6 months, and we partner with local child care providers in the community.
Debbie Schroeder, I serve on the board of Buffalo County Community Partners.
I'm Doug Kramer with the Buffalo County Attorney's Office, Administrator for Juvenile Services. One of my jobs, I guess, is to write grants. We've purchased some of the forward-thinking stuff from change companies, so I'll pass those around. There's quite a few different varieties. We have a community-based grants through the Crime Commission each year. Right now, we have funds for Voice down there in Home Ecological. We have family support that Compass is doing. Right around 170,000. So if you have ideas between now and December 21st, when the next grant for this next year starts July 1st, but the grants due in December, shoot me an email. I'll put you to work. Just the email is not enough. You gotta come up with who, what, when, where. But we do put at least half or almost 100,000 of that back into the community to make referrals to programs. So thank you for all your work.
I'm Helen Kramer. I'm with Region 3 Behavioral Health Services. I'm a professional partner there. I work with families with children with severe behavioral challenges. And I help facilitate the wraparound meetings every month and help locate supports and services that would benefit the family.
I'm Megan Andrews, and Senior Director for Boys Town here in Central Nebraska. Boys Town is a lot, so I'm going to try to keep it brief. The Omaha area, we have our residential programs, we have our hospitals, we have our research department. On a statewide level, we operate the Boys Town National Helpline, which is also, if you call 988 in the state of Nebraska, that kicks over to our hotline. So we have the Nebraska Family Helpline and Safe to Help kind of all rolled into that. We do offer our common sense parenting classes that are evidence-based virtually in different communities across the state. And then locally, kind of under my scope of services, we have a level 3 sped school that's K through 12 just outside of Columbus. We have a behavioral health clinic in Grand Island that's 7 doctoral level outpatient providers. We have outpatient child and family therapy and psychological assessment. We have our in-home family services that Doug referred to as ecological in-home family treatment, the juvenile justice world, somehow got branded that way. It's not my decision, but it's our newest evidence-based program that Boys Town offers. We've offered it for a while, but we just made an evidence-based registry a few months ago. And then we also have our foster family services where we train, recruit, support foster homes. And our newest initiative kind of falls under, we call it Lift Together. It's a multi-tier system of approach where we're working in schools to reach as many kids and families through the school, because a lot of our kids in our system involved. So it's getting to them a little bit earlier. So it's kind of an array of services that schools can choose a menu. So there's a full Lift implementation in North Platte where they're doing, well-managed schools, all the teachers are speaking that same language, and then a school support specialist, which we are bringing a school support specialist to Horizon through some of the juvenile services crime commission funding with Doug. We're excited about that. Hopefully we'll have someone hired and then training in November or December. But really working with those kids that have some higher behaviors, but more proactively. So it's not always stop doing that, you get detention, you're suspended. It's practicing those skills so that they can stay in the classroom and taking a little bit more positive approach to that.
My name is Gabe Kowalik. I'm a lieutenant with the Kearney Police Department. Some of the things KPD is doing to build positive relationships with the youth. We have 3 school resource officers working all the schools. Like I said, they try to build those positive relationships with the parents, with the kids. They go to all the schools. They do presentations. They'll go with the bright futures up through the high school. They'll meet with parents, just trying to make that positive impact. They're on the Youth Citizens Academy in the summer, which just started this year. Seem to get a lot of good positive buzz on that. We have NETS, which is neighborhood engagement for sports, where officers will get out and throw balls with the kids, play sports with them. They'll provide that equipment to the kids. We have officers that are mentors with Kids Hope USA. I'm going to butcher this too, but they're also mentors or volunteer their time, and I think it's called Royal Team Camp, I believe. We have officers that do that. And then also we have investigators that will do presentations for parents, cell phone safety for kids, also drug trends, things like that for parents to educate. So thank you for the lunch. Very much appreciated.
I'm Kathy Gifford. I'm on the board of directors and Kearney Public School Board. So thank you for everybody for what you did for this.
My name is Penny Parker. I'm the Community Outreach Coordinator for Nebraska Total Care. We're one of the Medicaid plans here in the state. I'm also a current parent, and I serve on the ARC board. The ARC board serves individuals and families that are experiencing disabilities, intellectual or developmental disabilities. I feel like it's an important piece to remember as we sit around the table. Yeah, we've got a lot of programs through Medicaid that I hope to be able to provide insight on as we were having discussions. And then if there's stuff here that I can take back to our plan as we try to improve health outcomes, we want to be able to do that too, and being able to hear what's happening in our communities is a key part of that. Thanks for having me.
I'm Candy Koenig. I work with the Monroe Meyer Institute with UNMC, and I'm located here at Children's Physicians. I work with families who have kids with disabilities or chronic health care needs, especially with early intervention pieces. And I'm also on the board for Disability Rights Nebraska, which is the protection and advocacy organization for the state. And they also serve those who are most vulnerable.
Sorry. I'm Ellery Butterfield. I'm the youth coordinator here with the Buffalo County Community Partners. And if you've heard this before, I'm just gonna do a quick spiel again. I run 2 youth advocacy programs. One here, thank you, Mr. Owens, for this, but one is called Photo Voice, and it's a way for youth to advocate for themselves using photography, using cameras. It's all free to them. It's an 8-week session, and the application process is ongoing. So get in contact with me if you're interested in any youth receiving that service. We also have the Youth Advisory Board, which is, it's a little bit more formal advocacy process where the youth meet once or twice every single month and just kind of discuss what they're seeing in their community, ways they want to improve, things they want to work on, and then we work on getting you guys connected with them so that they can partner with you and do that, so.
Brian Keeler, juvenile probation officer here in Kearney.
Megan Mullen, juvenile probation here in Kearney. Krista Fritzen, clinical psychologist and the director of Beacon Central. Just changed the name officially. Instead of Beacon Kearney, it's BHECN Central. And I've been at the position just over about a year and a half. And I teach undergraduate psychology at UNK, and I'm a clinical director of the Ross team. And I guess I wanted to just give a shout out to the officers real quickly. I know you shared the direct stuff that you do, but they are doing CIT, crisis intervention trainings all next week and the next week. They participate in our mental health first aid, loss programs, all those. And so, I mean, I think it goes well above and beyond what you do with direct services. You know, I mean, there's an intentionality behind it, and I just wanted to say that. And everybody has, but I just get to be privy to some of that, so I appreciate all you. Thank you.
I'm Haley Yelenek from Two Rivers Public Health Department, and I mainly work with minority health and overdose prevention and working on getting a suicide grant. I'm Janelle Brock. I'm a licensed independent clinical social worker at the VA in Grand Island, but I cover the western part of the state. So I'm here not to work with children, but to work with you guys who work with the children, and the veterans would be the family members or the parents of those children. So we do have the 988, as everybody is aware, and we have information that if the veterans will press 1, we get that information back to us. We get notification that somebody has called, so we'll call to see if they're doing okay or try to get them in, or whatever the case is. So my job is to do outreach and education. So I do presentations, I will set up tables. We also have a legal means safety program. So I do have tons of gun locks. If anybody needs gun locks for any of their families, we can provide those to you. And I'm just happy to be here.
I am Angie Johnson. I am an owner of a child development center in Kearney, Adventure to Success. Just opened 3 years ago. We are partnering with Sixpence and Buffalo County Rooted in Relations. I also have an in-home, and I have been doing childcare for almost 20 years now, speaking for the children.
Tana Miller, I'm the behavioral health coordinator at Community Partners. So I do get to work with our early childhood initiative as well as our adult behavioral health and through on so suicide prevention, some of our other initiatives.
I'm Nadia Asadi. I'm on the Buffalo County Community Partners board, and I just want to thank all of you for your time, first for what you do every day, but also for your commitment to this collaborative. So I appreciate the work that you put into it.
Jason Owens, I'm the principal of this fine building. I'm not going to take up any more time because Dr. Endorf took up
Matt Morse with Community Partners. I also could easily take up a minute, but I'll pass it on.
I'm Erin Small. I'm a Sixpence Child Care Partnership Coach with Kearney Public Schools. As I said earlier, I'm Nicole Hirsch. I'm a Children and Family Services Specialist Supervisor. I hate introducing myself. I don't know why. They think we need to call me. But I'm also a board member for, thank you. Thank you. I appreciate that. No, I'm done. I'm so awkward. I'm Emily Lehman. I'm a community engagement manager
with Unite Us, I house in North Platte, I cover casings, Grand Island, North and South, all the way to the Panhandle. We have a electronic care coordination platform where you can electronically refer students and parents for needs. The cool thing about it is that once that agency opens up a case, you get notified back that there is an open case. So alleviating the need to follow with parents or those providers to make sure that a case was open. So for history, Nicole and I used to work together supervising in CPS. So it's a really necessary resource. I'm excited to show you guys what that looks like later.
And my name is Dulce Valdez. I work for ESC9 as the Migrant Education Program Coordinator for the region, which includes Buffalo County, plus 17 other counties. I also help coordinate these meetings, and on the side, I also work for COMPAS as a mental health professional licensed practitioner, and I'm a mom of 6 kiddos. So I have there's an in-depth interest in the well-being of youth.
Nikki Gosman from the Safe Center. Sorry, I'm late. And I am a board member for community partners as well.
Michelle, I'm gonna hand it to you.
Thank you. Michelle Tucon, Buffalo County Community Partners. And I have my Zoomers go here. Let's go Leslie, Jessica, Amber, Natalie, Carol, and then Aldrich, and I'll drop it in the chat for you ladies.
Hi, Leslie Martin, Early Childhood Coordinator for Community for Kids, Buffalo County.
Jessica Vickers with Live Well Counseling.
I'm Amber Cochran from Hot Meals USA. And Natalie Hanna is on with us. She's an early childhood educator in our community.
And Carol Renner, community volunteer.
Is that Risa Aldrich? Oh. Hi, Risa.
Where's Lisa at?
She's with probation.
Probation, okay. Well, welcome, our Zoomers, we appreciate it. Good job, guys. Tiana was texting right now, I can see it. We were just 2 minutes over, that was pretty good. How did that go? Is that kind of nice to have that process, just to kind of get to know each other? Know that you just have a few seconds at every meeting, so everybody can be heard and bring some work to share with others. We'll try to make it as efficient with your time as possible. We thought we should start putting that into meetings. Back to the leadership team.
Aaron's gonna muddle through this with me. No. Yep. So we want to take a look at this document. This is really like our shared performance measures. And we wanted to talk about who our customers are and kind of deciding if we're in agreement with how we're defining that essentially. So right now, our impact will support parents and caregivers, which parents and caregivers are right now defined as our customers, of children with greatest potential for brain development, most often occurring prenatal to age 3, and again during pre-adolescence. And I kind of talked a little bit about that earlier. So is that, we had lots of discussion last time about, is it parents, is it caregivers, is it child care providers? So we just kind of wanted to expand on that discussion a little bit more. See what everybody's thinking about that.
This was our best draft of what we heard from all of you last time. I think they love it.
Anybody disagreeing with it? Maybe we should ask that. Sounds like everybody's okay with it.
Is the
Parents,
list,
caregivers?
I mean, how much do we do as a community? Is that supposed to be a list of every resource or things we're doing?
A little bit, Doug. So last time we just had like lots of conversations around that. I don't think it encompasses everything, but as we were having conversations, Denise was kind of putting things in categories. And then we're all the things that we talked about at the last meeting. So obviously there's additional to be added to that. We believe that's just kind of our starting point.
One of the pieces that's not in this packet that we did pull out because it's a pretty sizable document is the list of all of you who are here and the resources you have, for those that can send that to us. So we do have that information that we can drop in there. We just didn't put it in this packet because it's a pretty good sizable sheet of information.
One thing I noticed on this is in that the left column where we list all the different programs. I'm thinking of, that serves a certain population, of course, but I'm also thinking of a different population of parents who do not qualify for those programs, but are not so self-sufficient that they're well. And that group seems to fall through the cracks a lot because they don't qualify for things and they really, really struggle. So I don't want to forget that niche of families.
Here's an example of, just one example, more context of
I
what.
think last time we had some
I
discussion.
mean, I was an example of that parent.
Yes.
And I think we talked about, just because you have the at-risk factors, or a child that doesn't have those at-risk factors, doesn't mean that child's not at risk. We did discuss that last time. And we can't forget those kids because they are out there, and we can't forget those families.
I know one of the examples we talked about last time was like preschool, like specifically like bright futures, like if you're not within that income guidelines, then but you may not be able to get your kid into a private preschool because they're full or whatever. So that would be an example.
And I think that is a good point to bring up because that moves us into that next category, right? How well do we do it? And that's kind of defining what that gap is between what do we have and how well do we do it. We're missing having a little bit more conversation at some point in time about what that gap is.
And I think bringing in those prenatal visits and trying to hit parents early on. I know that there was a lot of discussion on, doctors do have a lot to cover in prenatal and those early well checks for babies. But I think that's an opportunity to hit a lot of families that maybe aren't in crisis, but maybe are.
We just kind of want to expand on these, right, on these categories. So if you take a look at how much we do, we're just going to go through each of these, and that's kind of like what we're currently doing. So if there's anything that you want to add to this list, I think Doug now would be the kind of offer some of the things out there. Back to your question.
Can I back us up just like, just a minor step, just back to our impact statement. So we say parents / caregivers. My only maybe 2 cents would be that we separate those out as parents and caregivers. Because I'm seeing that we also have like second step curriculum in schools. So we're talking more than just parents and caregivers. I do think we might be talking about like your childcare caregivers or providers and educators, and then also your school educators. And I don't see that represented in that statement. But I think when you're talking about pre-adolescents especially, you're gonna hit that population.
So do you think it needs to say parents, caregivers, and educators? Because to me, I put childcare providers into that caregiver category personally.
Care for the day.
Not for the day.
Thank you, Ms. Sarah.
I like that suggestion, because then you do cover all those bases with clarity. If it's not too wordy. It gives clarity to it.
So add the word educator.
In common, parents, comma, caregivers, comma, and educators, so that it covers the other, not, because I could see not parents and caregivers put together if you had that slash versus.
True.
And it has to be and not or, because we all have to work together to be a team.
See, we're defining our customer right there.
It's more laser focused. Last time, so that's great. And hopefully, we then went to focus on those age groups where brain development is most important versus focusing on the age groups. We just felt like we might go a whole nother meeting or two trying to narrow down the age groups. And we thought, let's just focus on those times when we know our efforts really need to be robust. Thank you, Shannon. Maybe segueing back to Nicole's question, if there are resources that we haven't yet mentioned today, because we've captured all of yours right around the table, is there anything else missing that needs to be on that list?
That would impact them to age groups, prenatal to age 3 and then pre-adolescence.
I feel like the list is a lot of 0 to 3.
I feel like 3 to 5, 3 to 5 is almost more important than that 0 to 3 right now, because they're with sixpence, they're being shoved in the corner. We're not gonna help them, we're gonna help them. And then they get to that 3 years old and it's like the pyramid.
So one of the things we did talk about with the brain development, hopefully if you have that good base at 0 to 3, hopefully it's continuing on
Once you get up to
into
that 3 to 5.
that 3 to 5 early adolescence, and then hitting it again in that pre-adolescence, since those are the major brain development in children.
Erin, just a clarifying question, what is pre-adolescence, just like what age?
Like early teen, like tween to
8
to 12.
It's not real defined, but yeah, I think we kind of view it roughly 8 to 12. somewhere there.
Google told me 9 to 12 because I just Googled.
Thank you, Google.
Santa?
It's gotta be accurate.
Most of the stuff we look at with juvenile justice is, you don't see too many youth that are charged under the age of 12. That seems to be the judicial mark, is age 12, where they know the difference between right and wrong, which most of us know. 10-year-olds, most 10-year-olds know the difference. Some adults don't know the difference either, but that's usually the age where they would start filing on them, would be age 12.
Or if you're doing the math in your head, middle school kids.
Right.
I always joke when we had 7-year-olds and it's our pre-diversion program. You know, sometimes they would go with an older sibling and break into a concession stand, which is burglary. But most 7-year-old is more of a parent supervision or caregiver supervision issue, along with older brother leading them astray. So.
I think there's also something there that's usually like the age of onset for substance use, and I just don't even see a lot of that as far as what we do as a community. Not that it's not there, but I don't see it in the box.
I feel like we kind of missed a lot of that 9 to 12. What are the resources out there in our community?
Anybody aware of any?
Region 3 has the Family Cares, the professional partner program. They work with ages 3 to 26.
I know we've talked about it, but I don't see mentoring programs anywhere either. Teammates and friends.
There's Kids Hope USA too, that's a new one, but that's for elementary school kids.
USA. It might be worth noting as well that a lot of private agencies are now able to offer sliding scale fees for families for mental health or behavioral health services, just because there's so much funding out there through FERSA and different organizations that if we offer sliding scale, then the clinicians who work within those companies can get some payback for their research. So there's some really nice programs out there that offer some support for them.
I don't know. Oh, God. I was gonna say, I don't know if this is qualified, but Nebraska School Care does provide memberships to the YMCA for our families, which can be helpful for middle school age kiddos to get into their program.
Ray was going to join us closer to 1. I don't know if he's on the Zoom yet, but he was one we noticed was missing, so we did do a reach out to the Y to join us. Thank you.
some of the private organizations like United Way, the Elks. I know the Elks have some drug awareness programs they do. We're just spending $1,000 on Red Ribbon Week. It starts this week. And I know our Coats for Kids started with a $2,000 Elk grant, and now it's over $20,000 with United Way, Goodfellows. It just kind of snowballed in the last 3 or 4 years. Goodfellows has always done coats for kids, and they do a warm welcome at the library where Head Start comes. They get their library book. They also get a hot meal, and they get a free coat. That happened a couple weeks ago. So some of those organizations spend a lot of time in the grant funds.
Sorry, I was just talking to the team one time.
Let's maybe, you want to move into, you want to move into the how will we do it next?
Yeah, I was just looking, Lancaster Leadership Academy. So they talked about bringing, because they came and talked to our office like back in May or June, and they were looking at starting some programs for like pre-adolescent age groups in Kearney. I was just trying to figure out what the names of the programs were. They came out of Omaha. Yeah. I think we needed that. So they have a program called Nightlight, which is after school and on the weekend nights. It includes like a hot meal, physical activities aimed at youth empowerment, group discussions with parent adults, and leadership development. I know there's certain ages for each of these programs, but it doesn't say on here what the ages are. They have another program called Healthy Kids Development. It connects children and families to mental health and behavioral health services. And then there's another one called Family University, which provides parents and guardians with programs that provide the tools for financial stability. So maybe we could look at inviting them to, I know they were just kind of trying to get set up and started.
How do people get hooked up with these?
That one I know is a referral system. Like I said, they came and talked to all of our caseworkers in late spring. And they said that they would have a referral process, but they were so early on, they didn't have like their location set up or anything like that. So thinking like that we could have them come talk to us, then maybe everybody could have that information. Because I know they said it was a referral system, but we did not. They didn't have that referral set up yet. So. But they serve ages kindergarten to age 12 is what their website says.
And that might be a good segue to kind of check into this next piece. The leadership team was considering that how much we do as a community could utilize Unite Us and that referral system. Like you're saying, how do you know when you have somebody you want to refer? Would Unite Us be that platform for starting to make those referrals, knowing more about what all these programs are that are available, right? And that we could be the group that helps promote that platform and those referrals, then we would have a lot of really great data, right? To see as Buffalo County, how well are those referrals being made, who needs to be added, and then who's utilizing those services, and then what's those gaps. So hence, when we were talking about that, Emily's like, I'll buy lunch and talk more about that. But I hear her stressing over here because her presentation's not quite coming together for her. So
technology issues.
I'm just
for a
gonna
technology company. It's
take
not
a pause.
surprising.
What would you like to do? Do you wanna-
Put me at the end. I'm working with our support center to figure out what's going on. I restart my laptop. I'm so scared of it. Everybody knows the struggle. Anyway, we'll be fine. If I can't present today, we'll do something some other time. I'm
We're working
always
on
around.
painting a picture. Can you now kind of visualize this picture? That's really where we wanted to get to today with this,
But
piece.
while you're talking, I did bring flyers about Unite Nebraska. They're over by the food. I put them out after we put the food out. So if you're interested, and I have a scheduling link that you can click as well. If I don't get to present today, we can chat more. So.
We have really enjoyed using Unite Us with our community response flex dollars. So when people are making those referrals for funds or for coaching, we've been using that. It's been delightful. Martha also has used the system and helping bring on board CHI and Kearney regional social workers. So when they're releasing people into the community that need some of those supports, they're using that system as well. So we'll talk more about it. That's kind of the picture we wanted to start painting for you. Is this the journey you want to go along with us on? To some degree, we may still have a few reservations, but seems like it's the best we've got at this moment in time. And then we're going to come back at a later meeting on is anyone better off? But that question is, how do we know that all this that we're putting in for early childhood, these investments that we're putting into every kiddo before they're born, when they're born, how do we know that that work we're doing is preventing them from entering any of those systems that I mentioned earlier? Abuse and neglect, juvenile justice system, premature death, those kinds of things that we were starting to define as a system. That's the big question we want to answer someday, because we want to make sure that all the collective work that you guys are doing is truly making a difference in the lives of children. So I think we have the agreement, right, for focusing on parents, caregivers, and educators.
So I'm looking at this and I'm thinking if they don't get a referral, which means if they don't have a caseworker or whatever, they're left in the dust.
So with Unitas, people can actually self-refer for services.
Okay.
And then we work with 211. They're actually a coordination center in Nebraska. So you can send referrals directly to 211 for a client, or you can send them directly to a provider in the community that's a Unitas partner.
So they don't have to have an LMHP or
No.
caseworker or something to
No.
be able to refer them.
Right, yeah, so if they want to self-refer, they just fill out a really quick form they can send online to their referral being sent out to a provider. And then that provider is responsible for actually reaching out to the client when they get the referral, not the other way around. So we're already working with people that are probably in crisis, and I'm not sure they have the capacity to reach out to 3 or 4 orgs if
I
they
can
have a
tell you
lot
they
of
don't.
things. So that organization actually reaches out to the client to open a case and chat with them. And then we do have network standards to just make sure that we have a really healthy platform. And so if an organization doesn't reach out within a couple of days, our team reaches out to remind them if they have a referral sitting there, so people don't fall through the cracks.
Good question. All free.
Oh, yes, it's free for most community-based organizations.
Sorry.
No, it's okay. It's okay. There's a caveat. So we're sponsored by Sync Health, formerly NEHI, Nebraska Health Information Initiative. And so the reason that there is no cost for most community-based organizations is because of that data sharing piece between clinicians and Sync Health. So Sync Health has this big data repository from their prescription drug monitoring programs and other things that they do. So they collect that health data. So somebody fills a prescription in the state of Nebraska, goes to a doctor's appointment, has a therapy appointment. Sync Health is responsible for housing all of that data. So because the clinicians have to share data with Sync Health, and then Sync Health shares that data back. So appointments, lab results, all of that. The cost is then distributed for them. So there's no cost for housing authorities, schools, churches, ESUs, probation, county attorney's office. It's all free. HHS. So if you do fall under that clinician hospital area, it's just an additional conversation to see if there is a cost. Sometimes there's not a cost because you're already insured. I don't know if that made sense, but
It made good sense to me, but I heard you talk several times. So that shouldn't be your monitor. So how well do we do it? Referrals and good data collection, we think is really important. That's why we want to talk a little bit more about what Unite Us might be able to do for us as a collective. The other element to that, and you guys started talking about it at the last meeting, is the parent perspective. So whatever we create, design, and do must be either led by parents, or parents are bringing up, caregivers and educators are lifting up what they feel would be the best support that they need for their children in that age group. So if you think about that in those two areas, and I think that's where we want to head next, is a little brainstorming action planning. Am I right? Yeah. Anything else you guys wanted to add? Don't you love this leadership? I'm just so excited for your leadership team. You're doing great work. All right, action planning. You all got note cards. There's no cards around. Does everybody have at least 6 note cards? If you don't have enough, we'll throw some more out. Maybe raise your hand, they'll come around. So your first instruction, thinking about this customer that you just defined. So this is a parent, a caregiver, an educator. What would be a quick win what is a quick win for connecting parents and providers to support children of these age groups? Can you say that again? What would be a quick win to connect a parent or caregiver or educator with a provider? That was your original intent of this.
What
word.
activity?
What quick win activity? Thank you. You want to repeat it?
No.
What quick win activity would connect your customer, which is what you just defined as a parent, a caregiver, or an educator, to a provider? You want a quick win, something that we can, maybe it's already in the hopper. Maybe something that would be real easy to do in the next couple of weeks. Write 1 or 2 ideas down on your note card.
And so what ages are we working with again? Because you talked about the birth to 3 and then
Prenatal, you can decide.
Okay.
Yeah, prenatal to 3. And then early adolescence, yeah, sorry.
Can you give an example?
Do they have an example?
So we talked, last time we talked, and I don't know if this would be quick or not, but at one meeting, it was the last one, we talked about like handing out certain pamphlets at like a doctor's office, something like that, something small that we could do in a reasonably short time frame that might have an impact. Yeah, just like an education pamphlet on like brain development.
That's what I
or
thought,
attachment.
but-
We talked a lot about bonding and attachment
maybe
last
it'd be more
time.
complicated.
Everybody have a couple ideas? All right, I'll give you a little bit more time. 1 to 3 ideas. How can we support parents, caregivers, educators? We're trying to prevent children from entering the system. You're waving your magic wand. You can do something. What would you do today?
Can I incorporate 1 into 2?
Yeah.
Or 2 into 1. I think we have a lot of great programs in our community, and I think a lot of people don't know about them. So I think I've gotten to hear Emily's, then she came to my classes. But I think improving the promotion of and or incentives for awareness for this, okay, I'm just gonna break it down to 2. Improve the promotion of our current programs, so increase awareness for our current programs, and 2, create incentives to get people who may be uncomfortable in those situations to go.
And I'm gonna add to Krista, say that's a great example. I'm gonna break you up into groups and we're gonna have. Sorry. All right, I'm glad you shared. So you may want to steal an idea, you can. All right, your next assignment, so everybody has 1 to 2, 3, 1 to 2, 3 items wrote down. All right, your next one, think long-term. If we were successful a year from today, what would that look like? What would those actionable items look like? So a year from today, we're all sitting around this table and we were successful. What does that look like? Write down 1, 2, 3 ideas. This is designed to be rapid fire, so it's like thinking on your feet. And those of you on Zoom, I think Michelle is coordinating with all of you. If you want to have your breakout group on Zoom, that would be fantastic. Okay, let's break up into groups of 5 to 6. Share one. Let's go back to this. Star your number one quick win. Not yet. So before you break up into groups, star your number one priority for a quick win. Now star, did you have more than one idea? If you have more than one idea for a year from now, star that one, your priority. So on your note card, you should have your priority of a quick win starred and your priority from a year from today start. Okay, then break out into groups of 5 or 6, share your priorities and come up with one priority as a group.
Denise, can I say something real quick? I do need to run, I have to leave the town. If anybody wants any more of those booklets, I have lots of them. So I'll leave it here for you to look at, but if you need more, if you'd like to utilize them, just let me know, I can get you some.
Sounds good. Thank you. Thank you, Helen. So I think you question 5 or 6 people gather around a table. I think these tables move around if you want to just pull one out or circle your chairs. In your group, you're coming up with your number one quick win, your number one where you want to be here from today.
All right, Zoom friends, I think. Hopefully I'm not talking into the room. Hopefully they made us quiet. So I saw some of you dropping examples into the chat, and I was trying to grab those and put them onto a piece of paper for us to look at. So we're thinking about quick wins, and then we're thinking about a year from today, where could we be at? So I saw in the chat, develop support groups for new parents, info at hospital when babies are born, weekend programs for kids when parents are gone and leave their kids home alone. I know there are a lot of opportunities when school is out during the week, but not on the weekends.
And I would just add, Michelle, just whatever of those ideas you pick, incentivize for the people you're trying to reach. There's got to be some incentive for them to participate. I think something for their kid, for themselves, you know, gift card or a book or something to grab their interest, to hook them. So I guess a hook to get them interested. For most of the parents, though, as you've said, those meetings and education would work for most, but the tough ones, they need a hook.
Thanks, Carol. Great thought. Jessica or Leslie, you guys have anything else to add?
Well, I said we should do it at the doctor's offices. They give baby welcome bags and they have formula in there and they have all kinds of brochures and information. I think we should hit those, put it in there.
I think my brain's going too many different directions. I don't know how to pick what a quick win activity could be. I agree with everything that I've heard as far as getting resources in the hands of people. But then I agree with Carol, then there's a matter of just because it's in the hands doesn't mean they'll do anything with it. We see that all the time. I mean, even with transportation, people say they need help with rides. We'll line up transportation, we'll pay for it, and they still won't get in the car to go to their appointment. So I guess in me, I'm like, if I waved a magic wand, yes, I would love to be able to hand somebody, be able to have resources to give to somebody and they would follow through with it, but that's not what's going to happen. I shouldn't say that's not always what's going to happen. It's going to happen for some. So I don't know, sorry, I'm trying to I'm making it too complex, I think.
You're being realistic.
Mhm.
That's the problem.
Um,
Right, you'll never reach all, isn't that right, Jessica? I mean, but you just reach out to,
right, you reach who you can.
I think too, Jessica, I mean, those are great thoughts, and I think that way a lot too. I'm like, we can't make someone take the resources, right? I can have a great resource packet, but people still have to read it.
And right, and we're talking about the keeping certain folks out of certain systems.
Mhm.
Unfortunately, it tends to be the ones that enter the system are going to be the parents that don't follow through with the resource.
Mhm.
If that was the case, we probably wouldn't have a lot of kids in different systems because there would be follow through and engagement with certain activities.
And I'm probably thinking a little too long term, because when we were talking at our steering committee meeting, when Emily was there about Unite Us, I was like, can we track and see if every kid in Buffalo County had the opportunity to have access to resources?
Yep, I think there's
Right.
that. Do they have the opportunity and
Mhm.
access to it? And if they have the opportunity and access to it, will they access it?
Mhm.
people don't know their needs until there are difficulties, as you guys know, and providers, and then you're doing, remediation, whatever. It's so hard to get them to think ahead of what their needs are based on. They're kind of like, they're that frog that's in the pot and the water's on, but they don't know, that it's getting hot until they have to jump out. So that's the dilemma, I think.
I don't know. I don't have obviously experience with my own children, but I feel like people are probably, it gets past this prenatal stage, right? And then it's like, oh, my kid is truant at age 12. I need help now. Carol, kind of what
Right.
you're saying, like they don't think to, I don't know, kind of have those resources when their children are young. I don't know, Leslie, does that connect at all with you? I know you're working in that lane more.
I think there's a little bit of both. I think there's definite things that a parent can see leading up to probably more significant concerns. And then I think there's some that aren't. I think you get a little bit of both. Okay, so quick win. I'm still trying to think of a quick win, guys. I'm struggling.
Quick win. I like what Leslie said. Sorry, I like to have been taking notes too of people. Leslie, in the doctor's offices, do you want to talk maybe a little bit more about that? Did you have any other brainstorm ideas of that?
Well, this is so old school. Do they even offer like Lamaze classes? I know at one time I thought you had to attend a Lamaze class in order to have a baby at a hospital. Maybe they've done away with that, but I was just kind of thinking, if we could work with the health system locally and just say, we'd like this as a prerequisite. I don't know if
I don't think they require any parenting classes anymore. They didn't when I was pregnant.
Okay.
They do give you a bag of goodies.
Because I know we got to go tour the hospital and I don't know, it was just, a lot of information given at that time. Maybe that's something we need to say, can you bring it back? I just don't know.
I remember this would have been 7 years ago, so I mean, not terribly long. There was a lactation consultant, and I feel like there was a social worker that checked in just to see if we needed any additional resources.
Okay.
But there's nothing required to have a child.
See, I good Sam, and this has been over 20 years ago. It was required that you attend a Lamaze class before they let you have a baby there. Now I know at Kearney Regional, they have that lactation specialist. She's on site all the time. She's got a little office right there. I don't know. I don't know if that's something they'd be willing to share our information when they talk about that too, or, we need to find that champion that'll help us share that information when they're there at the hospital. Just to put that bug in their ear, even if they don't act on it, they've been exposed to it.
Yeah, when I had my first child in North Platte, I even had a nurse, I think maybe, did someone maybe say this last time at the meeting, but I had a nurse come visit my house like a
Oh.
few days after we were home. And I think we did have like some sort of Lamaze class that was required too, but then when we moved to Kearney, there was nothing.
Mhm.
So maybe we need to find other places that do it well. And, you know, not reinvent the wheel, but kind of get some of their ideas.
Yeah.
But, you know, those places could have changed too over time. But there's got to be someone, you know, someplace that does all of that stuff.
Like I said, we're just exposing them to the information. Doesn't necessarily mean they're going to do anything with it.
So if we go along kind of with that idea, what did Denise say? Priority from a year from today. So what would like that look like a year from today if we were able to work in this space? Like every doctor's office would have packets of resources, every mom
Every
that has a
doctor's
baby
office,
goes home.
every hospital, when you have a baby, free parenting, prenatal classes. They're not free. Like, I guess last time I had my kid I had Jackson at Good Sam, and they had a lot of good classes, but they weren't free.
Really?
No, I could afford, I mean,
Yeah.
that wasn't an issue for me. But it's,
Maybe we could put our information on a pack of diapers.
Good idea.
Diapers, you have to take our information.
Great idea, Leslie.
Because diapers.
but
are-
I think having him, but I also think you can offer classes and then there'll be people that are like, I don't need that.
Mm.
Yeah,
My
they
mom
almost
didn't
need to
have
like
that, and
require.
she was fine, so I'll be fine.
Well, one of our
I kind of
problems.
like how they, oh, sorry, go ahead.
I'm just thinking one of our problems is we're looking for a remedy, but we haven't defined, you know, who needs the remedy. I think the majority of people are doing okay and they have ways to find the resources needed, and that's not an issue. So we're really trying to determine the population that we need to narrow down our thinking from everybody to those who we know that we've always known and we've never had solution that aren't going to use resources as provided. But so we don't have a problem, I don't think, community-wise in getting our education and information out there. It's just the user level where needed.
And talking about at this level, then we can talk, I mean, prenatal and postnatal depression, I mean, it's so stigmatized. I just think there's so many women that are experiencing it and don't talk about it and just think maybe either they think something wrong with them or they don't, I don't know. I still think there's a lot of stigma. I mean, there's stigma around mental health. I think there's stigma around a mom saying she's sad because she's having a baby or she's sad after she had a baby. But there's not a lot of, we have one provider in our office that's certified. I don't know how many, I don't know that we have a lot of providers certified to specialize in prenatal and postnatal depression.
I like that you're narrowing it down, Jessica, to a population, you know, of people who we need to determine if they need natal prevention versus the whole population of our community. And maybe the providers, I don't know who defines that. I don't know if it's your church, your mental health providers, who is it, the hospitals that can be the source to get literature and information to those people who are experiencing the postnatal depression and all. Who is the source to get our information to them?
I like this conversation, Jessica and Carol. So the groups are talking about a long-term strategy as well. I think they're brainstorming a few things. So I wonder if a long-term strategy could be finding the gaps, finding who actually really needs this information the most is kind of what I'm hearing Carol say, and a little bit of Jessica, what you were saying too. You know, so how do we keep
Well,
refining and
right.
defining who needs what?
I think there's a narrow group, but I think even as a whole, again, when we think about, you start narrowing it down, I think there's just a lot of, I think women in general have ideas of what it is supposed to be a parent and how you're supposed to feel about it. And there's things that you just aren't supposed to talk about. I still think that happens. Even personally, like I wouldn't say I experienced postnatal depression, but I was grieving my life that I had before kids, all the things I could do and now I can't do. And it's not that I was necessarily sad, but I mean, that was a little bit of a process. And me, I'm very vocal. I don't have a problem talking about it. But when I would talk about it with friends, they're like, oh my goodness, I experienced that too. I didn't, I thought that was just me. And I'm like, no, like that would be normal to me. Like we're grieving the life we had before we had kids.
So maybe, Jessica, with what you just shared, maybe it's kind of that triangle, that layered process of this is what everybody needs. And we need to address that with the kind of things Leslie's saying, get information out. Maybe there's that middle level that is like, I don't know how I should feel. So is there like a group of support, whatever? And then there's that top level that they don't know what they need. When they get it, they don't want it. And so maybe it's kind of a layered approach to our work instead of one size fits all.
Yeah, I would agree with that.
Yeah.
I like that. All right, we're coming back to our big group. Jessica, I vote you as our spokesperson if we're called on.
I don't know what to say.
I'll drop my random notes in the chat for you.
Okay.
We're more aware of it. Because my idea is if you put all this into like what I call the melting pot, then people are more willing to dip into the melting pot because they know that there's other parents and other people out there that are having the same problems as them. There's a parent that has a child with disabilities. I may not know what to do when my child has behavior. And there's a parent standing right next to me that says, oh, I have the same problem. Wow, I thought I was the only one that went through that whole tantrum in the middle of the grocery store and you're embarrassed as all get out and you're wanting to leave your kid there and walk off and it's not yours. You know,
Keep us moving because I want to make sure everybody gets number 2. Great idea, education or education for adults. Group 2, as hard as you can.
Our group talked a lot about promoting and awareness and all of that, but we kind of came to the point that if we're going to promote the website, we want to make sure that website is simplified, easy to navigate, user-friendly. So we thought that would be a quick win, is to take a look at that website, maybe make it interactive, so it's a little different than, I mean, not necessarily interactive, a little different than like a resource of 211 or MyLink. So you go on there, you click something, and it kind of guides you to the next step instead of just being resources. It's more user-friendly and walks you through.
Okay, thanks,
Did I capture it?
Thank you. Next group.
We discussed using the platform, I don't even know what it's called. Social media, thank you. It's true. With social media to, so when we work a lot with parents, it's a lot of information to take in, but using maybe some video clips or videos to connect with parents via social media.
Okay, next group.
So we had a few good ideas. I mean, I come from a very Boys Town. Next week will be my 15 years with Boys Town, so it's like what I know and what I do. But Boys Town has parenting.org as their website, and there's a lot of just digestible tips for parents, like 5 tips for monitoring your kids' technology use, or what to do if I think my kid is self-harming. Those types of things, and there's lots of just quick tips, ebooks, email series, and so not only finding ways to disseminate some of that, just like quick tidbits, but then also including like local resources, like, hey, if you want to connect with someone locally who might be able to support you more in this area, here's some therapists, or here's community response, or whatever it is. And one way that we might be able to do that, this is Penny's idea, is actually bridal fair here in Kearney that they do every year.
So I was thinking of the bridal fair, but I was thinking of a parent fair, right? Like, or a new parent fair that is in a similar kind of setup, where it's fun and supported by the local media and really engaging. I know we have a lot of stuff that is very like services based, but if we could get more like of a vendor vibe or like a shopping craft fair connection where you've got people, attendance is already there. There's an opportunity to have breakout sessions or collaborations. We might be able to catch a wider net casted there to pull some of those issues in.
Good ideas coming. The next group, Probation and Krista.
We kind of, I mean, very much in a similar vein. I think we were discussing getting some like a resource list that is all encompassing. We were talking about how Unitas does this, but how maybe getting information out to people about Unitas. And then also coming up with a way to incentivize people to use those programs more. When I say people, I mean parents specifically. Please add to that because I don't think I captured everything.
Okay, I did, like quarter group.
Oh, sorry, that's me. I'm sorry.
Yeah,
Distracted.
okay.
Yes, so we actually had the same conversation that I heard everyone else was having, an interactive website, so my link more interactive. So we're gonna share something else because everybody else has already done that. One of our quick ideas was community response coach. So you heard Wanda and Martha talking about community response when somebody comes to them. A community agency comes to them with a need, they've got a family, they've already exhausted the other resources in the community, or there's not a resource in the community. So we would like to get a community response coach to work with our childcare providers who are already working with a lot of families. I cheated a little bit because I'm hopeful that we already have this in the works. But then, are we doing long-term? Not yet. Okay, so that's that one. I'm trying to be quick.
Michelle, your team.
Jessica is going to present for us.
I'm going to do the best I can. Our quick win, we talked to, can everybody hear me? Okay. We talked about just going back to the doctors and physicians handing out bags for new moms, like when you have a baby, that a lot of times there's bags with resource or with stuff in it, and ensuring that those community resources and mental health resources are in those bags. This then led to more conversation around prenatal and postnatal mental health, but that was our conversation over our quick win.
Fantastic. You want to keep going, Jessica, and tell us your 1 year from today?
What was that?
Keep rolling and tell us your 1 year from today idea.
Well, we just kind of talked like 1 year from today, we'd have more kind of like a layered approach of being able to finding what needs as a whole, the community needs around like prenatal and postnatal depression. And layering that down to more specific to those who do have it. We kind of, the conversation was around, I gave my own personal example of when with our first child, even it wasn't necessarily that I experienced depression, but there was a grieving process of grieving my independence, grieving my life that I had before children. And I'm a very vocal person and was willing to share that. But when I started sharing that with friends, they were like, oh my gosh, I experienced that too. I didn't know that that was normal. So I think that there was just some typical conversation that a lot of people have, but then narrowing it down to then more people who have more prolonged concerns or depression or feelings that leads to either that prenatal depression or that postnatal depression, and how to get them connected with those services so that they can support their new babies and their kids' development.
So I wrote down, Jessica, like a layered approach using some sort of peer-led or parent-led conversation and using the example of prenatal depression.
Correct.
Thank you. Let's go backwards. You want to go, Tana?
Yeah, so for long-term with the community response childcare coach, it would be the amount of families that we would be able to track referrals through Unitas, and the long-term, I guess, support that they receive through community resources.
Great.
In 1 year, we would know that our resource list was successful and the monetary incentives are successful if youth and parents are aware of the resources, and instead of us encouraging them to go to those preventative ones, they're encouraging each other to participate in those programs.
That is beautiful. Hey, corner.
Well, one idea, yeah, over here. One idea is that, you know, every organization has a resource list on their website, and it's how parents can actually access it, especially if they are in crisis. You're just not thinking as clearly as you would if you're not, and how to access it, and you don't know what you don't know about it.
Okay. So your 1 year from today is parents would know where that access is? Okay.
Because there can't just be one
There can't just be
master
one
list, because no one can keep that up. So how do parents access active, reliable resources?
Can I say parents know access points in the
Yeah.
community? Would that work? I didn't want to put words in your mouth. And this is just around resources, right?
Yep.
Denise, can I ask a question?
Yeah.
Like, this could backfire every time, but how many people here know what MyLink is? So I think we know, but who else knows? And like one of the things I do in my classes is 60 students this semester had to did a report on that MyLink and did reviews, which I'm gonna send to you. And you can get into wherever. I know there's a number on the app, but, and then they had to share it with 5 people. So if we could create that, I don't know, people make lots of money on those schemes. I'm not hard enough, but so that was just, and I was hoping that nobody knew about. I'm kidding.
They know about this. All right, back to this corner. Your 1 year from today, what does it look like?
We are hoping that we could promote parent advocates to participate, and that they would be able to share some of their knowledge, so parents begin to understand the value of engagement. And then maybe including that in some in-kind expectations or something of the sort for the Head Start. I think there's some of those early development programs, that there was an in-kind process where parents, instead of payment, you do an in-kind process, and you come and you are responsible for being part of watching so much or learning about your child's development needs.
So the system would have some sort of parent engagement like Head Start, is that what you're saying? Or it is Head Start?
It could be any early development program. It could be a childcare setting, it could be a break place, or it could be anywhere. But there's kind of an in-kind process where, as they come to learn about their child's development, they also become a parent advocate that then kind of continues to promote.
Get that buy-in with parent engagement.
Okay, love that too. You're doing great. Next group.
We didn't get to the long term. We did think though, like parents would know how to access resources in the community, probably tied it in there. We started talking about like social media and TikTok, and so a 1 year would be, we have a TikTok that has hundreds of views.
Tens and tens.
Yeah.
All right, and our last group.
Parallel conversation to the rest of you, just creating that web of support that would be advantageous to parents of, a variety of backgrounds.
Wow, I am just really in awe. Let's just take a moment, soak all that in. Your quick wins, very closely aligned. I mean, just a little bit of conversation. I think you might be onto something. Your 1 year today links so well to that too. So I think in a little bit more conversation, we're at 2 o'clock now, so we probably do need to wrap up here, but we'll bring this back to the next meeting. I'm going to challenge you on a couple of things. This, I heard here, very heavy, what we think parents need. Is this what parents need?
Well, it's not just parents, all customers, so.
All customers.
Yeah.
So what educators need?
Yeah, so if you're serving parents today, you want to start asking that question of them? And then start asking if they'd come to a focus group maybe? And tell us more. I'd like to flesh this out a little bit. I mean, I think we have an idea of what we would like to see happen, but we need to make sure that it's supportive to get you to that point. Because over here, you are saying parents are totally on board and they're engaged, but over here, they're not a part of the process. That's just my first aha in listening to what you're saying.
And there's a lot of families who don't have access to technology. So if we focus so much on social media and web, we're leaving out a chunk of people.
We did talk on this side too about, besides the resources on website is both the old and the new. So paper forms in places where people can access them. Walmart was Jason's suggestion, our bathrooms.
Well, Jason had a very good, when you go to the motel, hotel, and all these pamphlets of what you can do, you go to Walmart and there's all these pamphlets and resources. If you need mental health, if you need drug abuse, if you need. you
And
just
there's
grab
also
them.
a link to the site. So,
Yeah.
One of the things we talked about is family engagement in schools. It's okay. Talked about family engagement within the schools and within the child cares. As a parent, I don't have a lot of buy-in there. I'm not gonna lie. Busy family, how can we get that buy-in for that family engagement? And that includes the school staff, not just the parents coming. Because sometimes you go and the school staff isn't necessarily there for some of those pieces too. So I do go sometimes, but not probably enough.
It was interesting yesterday, we were with Nebraska Children and Families with the 22 collaboratives, just like you. You're not alone. There are 22 others having these conversations, and their conversations line up almost identically to what you guys are saying. So, and there's actually a state plan to support this work, which is also kind of exciting. So family engagement centers come up quite a bit because they exist with Sixpence, and then what does that look like building into that as well? So yeah, great. We are 2 o'clock. So leadership team, we are going to bring it all back. Bring it all back.
yeah, we are.
Emily has tried so hard.
No, I have it pulled up, but I can't do much. I'm in the live environment, so there's not much demoing because it's real people in here, real clients, real information. But let me share my
So we
screen.
just have some.
Yeah,
just
if you
a
want to
few
stay, don't
minutes.
feel like
She's
you
got
need
some
to
good stuff
stay.
here. If we go 4 weeks, we land on Thanksgiving, so we made an executive decision to go with November 20th or 30th as your next meeting.